Sudden infant death syndrome is defined as the sudden death of an infant less than 1 year of age that cannot be explained after a thorough investigation is conducted that includes a complete autopsy, an examination of the death scene, and a review of the clinical history. In other words, what things we saw either at birth, in its baby visits up to that time. SIDS is a major cause of death in infants 1 month of age to 1 year. The most are seen between 2 and 4 months of age. The total number, I don't have it off the top of my head, but the statistics are, in the best data we have from the Department of Health and Human Services, in 2002, for all races, there was 57.1 per 100,000 live births in America. So if you take and round that down, it's like 0.5 or half per 1,000 births, or if you want to think about 1 per 2,000 live births. In the state of North Carolina, the most recent data we have, in 2008, the SIDS rate was 105 per 100,000, or a little over a 1 per 1,000 live births. When a parent puts their kid to sleep, and this has changed totally since when I was a parent. I was a parent, my kids are 20 and 22. And at the time, we were told to put our children on their bellies. That's passé. We don't do that anymore. So the basic tenet here is a program that was started in 1992 and 1994 by the Department of Health and Human Services. Is called Back to Sleep. And the reason we call it Back to Sleep is you put them on their back to go to sleep. And sleep is defined as for the night or for a nap. So if you're going to put your child down for a nap, or if it has gone to sleep in a nap, which they do, then we put it on the child on the back. You want to not put it in a beanbag chair or a soft cushion or on a pillow. You want to put it on a firm surface, like the modern crib beds we have today. And when we say put it in a modern crib, we can't use the crib that when I was used in 1957. That is not considered safe today because we can get entanglements, the sides can go down. So we want to use a modern, safe crib. We don't want to use that bumper guard. We don't want to use the pillow. So in those sets of things we get, we don't use the pillow, we don't use the bumper guard, we use the ruffle. We could use the ruffle on the outside where it can't get the baby. So we put the baby on the nice firm mattress. We want to dress the baby so it's not too hot or too cold. So a onesie type device, a blanket, light blanket if you're going to use one. If the onesie's appropriate, no blanket in there, no stuffed animals, nothing that the baby could suffocate itself or get its head up against. Because when the babies are real young, it's very difficult for them to secure or get themselves to roll over to get away from something if it does get in the way. They tend to be weaker. So we want to make the bed safe. We don't want to put it in an area where somebody could fall on it. The crib has sides that are protected. So. When a parent is in the hospital and the baby's just been born, the hospital staff starts right off in the beginning. They instruct the parents to put the baby on the back. But if you're like me, I remember when I was a brand new parent, sometimes those things don't stick. Your mind is reeling, you're amazed, now you got all this, the baby's crying, the whole feeding thing. So there is websites, but we also have take-home brochures. They have wonderful take-home brochures that talk about the helpful hints. Each and every person getting home from the hospital has that pamphlet. On the North Carolina site, they have one that even explains to parents. Like I would have to explain, my kids, if they had a child, would have to explain to me as a potential grandparent, hey, how come you're not putting the baby on the belly? You have to put the baby in the back. This is modern, this is new school, just like tweeting and texting. These are new. We've now realized that we've reduced, because when we did go from belly to back, and we went from 70% on the belly to 20% on the belly, we dropped the rate of SIDS by 40%. dropped the rate by 40%. That's a lot of saved lives. So that tells us that the position put on the back does reduce it. So there's take-home messages, and then when you go back to the clinic for the brand new 1 week, 2 week visit, they'll reinforce this. And again, at the 2 month, the 4 month, the 6 month visit, each of the visits, that material is there. If you've lost it, misplaced it, you have to explain to your babysitter. I mean, as a parent, that is one of the things we have to make sure that whoever is taking care of the child is also following these sound, safe, preventive measures to optimize our chance of survival for our child. The ones that I used, I went on to Google and Dogpile, they're both search engines, and I typed in SIDS, CDC, and I pulled up the CDC, and I consider that Center for Disease Control, and they actually had very good information. The other one I would do is SIDS, SIDS, DHHS, Department of Health and Human Services, and up again comes with this. Now there's other things out on the web. There are other sites, people touting that you need to get a special mattress and other things. The CDC has been looking at those. They have not seen that. So I would go to DHHS and CDC as good primary sources, respected research, you know, it's evidence-based medicine, what they're coming up with, so that you don't use that hard-earned money to get things that might not be as efficacious as they're advertised. When you take your child to your visit, there is no question that is considered dumb. When you get there for your first visit after you've been discharged from the hospital, there's some things that you're going to have forgot because the adrenaline of the delivery, the new child and stuff. Ask at that visit. Ask about, hey, I have this question about my baby. And if you have an issue, you see something that doesn't make sense to you, some behavior that's troubling to you, some issue with respirations, make sure that you contact a healthcare provider at your primary care manager to say, hey, my baby did this, and ask, is this okay? Because many of us are away in the military. We're away from our families. We don't have our mother, our grandmother to go and ask those questions. So in the military, our healthcare clinics, our healthcare providers act as an extended family. There is no dumb question. Ask those questions so that we can help you. I mean, that's why we're here to help you. Make sure that no matter what your clinic is, know that number so you can call it and get that information. And there's always someone at the hospital, whether it be in the emergency room or some other location, that can answer those questions for you.